Wednesday, March the 11th, the Trudeau government has introduced Bill C-8 at first reading, which is new federal legislation that threatens to jail parents who try to help their own gender-confused children find peace with their biological gender. The Bill C-8 defines conversion therapy as a practice, treatment, or service designed to change a person's sexual orientation to heterosexual or gender identity to cisgender, or to repress or reduce non-heterosexual attraction or sexual behavior. If C-8 becomes law, parents can face jail terms of up to 5 years for trying to help their son to accept himself as a boy, or for trying to help their daughter accept herself as a girl. Bill C-8 also would, if passed into law, would impose prison terms on doctors, counselors, psychologists, psychiatrists, whose treatment departs from the politically correct orthodoxy that the only way to help gender-confused children and teens is to get them started on puberty blockers, cross-sex hormones, and eventually surgery. Bill C-8 ignores the reality that most children and teens, if they're allowed to go through puberty, are at peace with their biological gender by the time they're 18 years old. This was proven over and over again in hundreds of cases at Toronto's Centre for Addiction and Mental Health, where Dr. Ken Zucker and Dr. Susan Bradley helped hundreds of children to come to terms with and accept and find peace with their biological gender. C-8, this proposed legislation now at first reading, also ignores the fact that hundreds of people are speaking out publicly about their transgender regret. And they're asking the hard questions like, why, when I was a vulnerable child, a vulnerable teen, why did nobody who's older and wiser stop me from irreversible damage to my body? Because once a young, healthy, developing body is subjected to puberty blockers and cross-sex hormones, there's no going back. But now, if Bill C-8 passes, it becomes practically illegal to help vulnerable children to come and to find peace with biological reality. Doctors, psychologists, psychiatrists are divided as to the best way to help teens, and the debate that has taken place should continue. What Bill C-8 would do, if passed, is it would be politicians shutting down the debate that ought to be taking place in the medical and psychiatric communities. And most of the politicians that are pushing this have zero training in medicine or psychology. Puberty is a time of angst and confusion and turmoil for many, if not most, teenagers, and parents, compassionate parents, loving parents, and professionals who want to use evidence-based treatment plans should not be facing jail time. I'm John Carpay. Thanks for listening.